Welcome to the Lean Blog Podcast. Visit our website at www.leanblog.org. Now, here's your host, Mark Graban.
Hi, this is Mark Graban. Welcome to episode 159 of the podcast for October 16th, 2012. We have a returning guest today. He is Dr. John Toussaint, the founder and CEO of the ThedaCare Center for Healthcare Value, based out of Appleton, Wisconsin. He's the author of two outstanding books. The first was On the Mend, and the second was titled Potent Medicine. So today we're going to be talking primarily about a new report that came out from the Institute of Medicine back in September. And that report was titled Best Care at Lower Cost, The Path to Continuously Learning Healthcare in America. So John's going to summarize that report, the role he played in helping review that report and give some input. And he's also going to talk about some of the things that we need to do to improve healthcare, not just in the U.S., but around the world. So if you're interested to dig more into that report before or after you listen to this, I'll have a bunch of links if you go to leanblog.org/159 to the Institute of Medicine website. You can listen or you can read the whole PDF free. You can see their summary document. You can see a lot of the data and charts to help put this into context for the discussion today. So as always, I want to thank you for taking the time to listen. Let me know if you have any feedback. You can email me at mark@leanblog.org. Well, John, as always, it's great to talk to you, and thanks for being a guest again on the podcast.
Great to be here, Mark. Thank you.
So we're going to talk mostly today about a new report, a recent report from the IOM, the Institute of Medicine, that some of the listeners may have heard of, or at least seen some of the headlines in the news, and we've got a great chance today with John to delve a little bit deeper. You know, the headlines included things like, an estimated $750 billion a year in wasteful healthcare spending in the United States. John, we can talk about the report and the role you played in reviewing and giving input to it. How would you summarize some of the key points, the high-level summary of the report and what it shows?
Well, I think they got it mostly right, I guess would be my first comment. They talk about the fact that our outcomes are not acceptable, which I agree with. They also talk about the fact that one of the main problems is that we don't have a continuously learning healthcare environment in our hospitals and clinics, which I agree with. And then they actually talk about some of the potential, countermeasures or experiments, solutions to the problems, and many of them revolve around, building a culture of continuous improvement, using focused tools like are part of the lean methodology to begin to change our operations, and so I think those things are all right on.
Yeah, and the report talks about cost, the quality problems, patient safety issues. IOM, their big report on the quality chasm and healthcare problems was 12 years ago,
right?
And it seemed like we're still. Would you agree? I mean, we still have the same problem that we're facing today. It's just around quality and patient safety.
Yeah, we haven't. I don't think we've made any significant progress since 99, 2000. I think that it is. If you look at the HHS study that was published in 2010, it shows about 15,000 Medicare beneficiaries per month are dying in part or whole related to errors. So we haven't made any progress, and I think that this report is a deeper dive into why that is, and it really does get back to this problem that we don't have a system that supports the real-time identification of problems and those problems being solved every day on the front line. And that's what they're trying to do here, is to describe what that system might look like, and both from a cultural perspective and a tool perspective and otherwise.
Yeah, so we can talk about some of those solutions. The report doesn't just identify, or state a problem statement. There's, technology, culture, different practices. Do you feel like the things that they recommended as we go through those are a good generally a good path? How do you find the balance between the technology approaches versus practices like lean and the culture that's associated with it?
Well, I was slightly disappointed in the fact that there was a lot of description in the report of using the technology as kind of the answer to some of these problems. I mean, we've been at electronic health records and data warehousing for well over 15 years now at DataCare, and we certainly have learned that that's not the answer to delivering 100% reliability in patient outcomes. That it's much more related to the processes and the management system and the leadership behaviors in organizations rather than the actual technology. And the technology is a tool, just like calculating takt time is a tool. But it's not the answer it's not the solution to creating reliable healthcare outcomes. And I think in the later chapters of this report, they talk more about the leadership commitment to creating a continuous improvement culture and those sorts of things. To me, those are the chapters we ought to be reading. And everybody knows about IT and EMRs and all the rest of this stuff, and there's a lot of problems with that. And what we need to be focused on is creating standard work at the bedside and for senior management, and following that standard work and improving that standard work, and getting to this theoretical limit of 0 infections and 0 errors, and as Paul O'Neill talks about it.
Yeah, and I mean, it's always tempting to think of technology as a solution. I mean, to listeners who might have, just a manufacturing and industry background, I see parallels. A company buys a modern ERP system for accounting and inventory management and customer record management. Doesn't mean that manufacturing company is going to be any more efficient than they were without the ERP. The ERP is sort of some of the foundation and nuts and bolts of just being able to run things, but it doesn't mean you're going to be even lean. The ERP often fights against lean. Can you think of an example that you can share? Maybe people who aren't familiar with this problem of how an electronic medical record or software in health in healthcare IT, for all of the promise and hype about it, what are some ways that it actually doesn't help make things better or gets in the way?
Well, when we worked on our activity in the inpatient redesign area, which was the collaborative care units that ThedaCare has really become famous for, one of the biggest barriers to creating information flow was sort of ironically the electronic health record. It had to be redesigned in a way that could support the actual clinical process redesign. And so the nurses couldn't get at information that they needed from different parts of the record. We couldn't get at information from the outpatient part of the record for medication reconciliation because there were firewalls between the inpatient and the outpatient. And so when we designed the new clinical care process to be one piece flow for the patient, the actual electronic component of that process wasn't one piece flow at all. There were many barriers. So we had to work with the engineers for the electronic health record to basically redesign the health record to actually support the new clinical care process. And it was interesting that we have all these barriers within our thinking and our process, but actually it was the electronic barriers that were some of our biggest headaches.
Yeah, and so when we talk about technology and process and systems, one thing that I had highlighted, going through the report here, there's a short phrase where it says, the authors of the report found that the learning and adoption of practices such as good hand washing and even the adoption of new techniques and drugs was what they said, was maddeningly slow. What are some of your thoughts about? I mean, does that all come back to things like leadership commitment and culture, or are there some other things in the report that talk about how to help this learning or this continuous learning take place?
Well, I think the other thing that I wish would have been a little bit more strong was this concept of development of standard work. I've visited 115 hospitals in 11 countries in the last 7.5 years, and almost every one of them I find lack of any standard work. And of course, Deming 101 is stabilize, standardize, improve. So if we don't have any standard work in place, how can we improve anything? And so we get these best practices coming out of scientific literature, which have proven that certain things work. And because there's no focus on standard work, these things take years to actually apply. So let me give you an example. Let's go back to the collaborative care inpatient redesign work. Within that redesign was embedded what we call the Milliman guidelines, which are evidence-based guidelines for specific disease states like pneumonia and congestive heart failure and heart attack and those sorts of things. And so what we did was we actually embedded those clinical evidence-based guidelines in the standard work for all the nurses, doctors, pharmacists, and caseworkers and everybody else who touches the patient, so that there's a series of toll gates that the patient goes through, and at each toll gate stop point, which is just a stop point to say, are we actually doing all the things we need to do, those quality performance indicators and guidelines are embedded in each one of those toll gates. So when we follow the standard work process through those toll gates to take care of the pneumonia patient, every single thing that needs to be done to create a 100% reliable outcome for that pneumonia patient is done. And that's what's missing in almost every hospital in America today, is that sort of rigor applied to the daily standard work of caring for patients. And I think that's that's one of the things that we need continuous improvement, but we can't have continuous improvement until we have standard work in place.
Yeah, and that standard work of not just how to do proper hand hygiene practices, but how to make sure people have time for it. I'm sure I know there are all kinds of technology solutions. People say, well, we need to spend a lot of money to install cameras. We can catch people not washing their hands, but there's a lot of other ways of addressing even just to that specific issue. How do we have standard work and leadership and problem solving? Those are the types of things that I'm guessing you think would show more promise in throwing lots of technology at that problem.
Yeah, so part of the management system of Lean is to understand is standard work actually being followed. And when we actually go in and look, whether it's hand washing or timeouts in the OR or pneumonia care, what we find in most places is that, first of all, there is no standard work. If there is standard work, it's not being followed. And many of the times it's not being followed is because the standard work is wrong. So, when we really peel back the onion and do the necessary auditing of standard work processes, we can figure this out. And that's really part of a system, a management system, which is part of the overall methodology of Lean that's required to actually assure that reliability, that we're going to deliver reliable results. So this is management by process, but you have to have the processes in place. You have to have the Kamishibai or the audit process in place. You have to have the daily defect huddles in place. You have to have all of these different components of the management system supported. and if you're going to build a system based on standard work and then improve that standard work.
Right, and the things you're talking about there, and with the other innovations through Lean at ThedaCare with collaborative care and other approaches, it seems like there is quite a clinical aspect to improvement. Looking at the IOM report, they break down that $750 billion into a number of buckets. I think they call it an operational inefficiency bucket was about $150 billion. And I think people would maybe most readily associate lean with that, preventing errors, reducing wasted medications, excessive labor costs, things like that. But then there was also a bucket of about similar size of unnecessary care. Can you kind of elaborate on that and maybe the ways that are less obvious to people of how lean is making a difference, and also making sure that we don't do the wrong things more efficiently through lean, for example?
Yeah, that report, the 750 billion, actually came from another committee that I sat on with Rick Gilfillan, who's the Center for Medicare and Medicaid Innovation Director. He and I, before he took that job, were on another IOM subcommittee that actually produced that report. So the 150 billion or so, we believe in operation inefficiencies are related to the error rates, the problems associated with delivering poor care, and also unnecessary care. So again, if we go back to the evidence, we know that there are certain things based on rigorous scientific studies that actually work when we're delivering care to patients. The question is, how do we embed that evidence into our daily work and make it work every time? And that really gets back to you need to have a system that enables that to occur, and that's really the lean management system. But it really gets back to standard work again. I hate to keep harping on this, but the reality is that those things that we know work in most organizations are not embedded into the daily work of the organizations. So the question for the leaders of those organizations is, what is the system that you're going to apply to make that happen? Because you can say, well, the staff just don't get it. The nurses just don't know how to do it. Blah, 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 blah. I mean, you can blame and shame. Yeah, absolutely. Or you can actually look at yourself and say, you know what? Who's in charge of the system? Guess what? I am. And what am I doing to create the processes, again, management by process, that makes sure that 100% of the time we follow the evidence for patients with pneumonia? And it has to be embedded into the standard work of every caregiver, in every department, as to delivering that consistent care each time. And quite frankly, Mark, as you know, I mean, most people don't even understand what their existing state of care delivery is. They haven't mapped it out. They don't understand the steps. They don't understand where the defects are. And so the first step is to just understand what your baseline is by mapping out your existing care process and understanding, where it's failing, and whether it's, is it failing because people are falling all the time and hitting their heads on the floor? Is it failing because we're giving them the wrong medications every day? Where is the system failing? And then, what is your existing process to understand that? That is not a technology tool. That is simply a different way of thinking about delivering care, and it starts with understanding how you're actually performing to begin with. So a lot of that $150 billion comes from the lack of understanding of those baseline care processes, let alone any standard work to improve them.
Yeah, and I think it might be surprising to folks who aren't working in healthcare. I was at an unnamed hospital a couple of weeks ago in the emergency department, and everybody there had the right clinical credentials. They knew what to do from a medical standpoint, and very quickly the team came to the realization. I didn't have to tell them this. They discovered. They said, "Well, you know what? We don't have standard work for how we discharge a patient from the ED." And we step back and say, "Well, that's getting to some of the root causes of why length of stay, was so long." And it's just, it's still, for me, still sometimes surprising, to see where there's just, there's so much focus on technical aspects of work, and people just haven't taken the time to step back and see how that system works, let alone manage it. So it's
we have some of the brightest and most well-educated people in this industry of any industry.
Yeah.
But we've never been trained on how to understand how to improve things. And so we have a lot of project mentality. We have a lot, okay, we're going to do this little project over here, but then we don't actually study and act on it. We just plan and do, and then we never really know whether it made any difference, and then we're on to something else. So, we really need this rigor of plan, do, study, act applied to standard work in order to understand, how do we get that patient discharged in a reliable, 100% reliable way every time, defect-free. And that's really what's missing in the industry, and quite frankly in the training. I mean, we can teach you how to take a complicated brain tumor out of somebody's head, but we can't figure out how to take care of the patient in the ICU in a way that they don't get an infection.
Yeah, and people, you're right. People are incredibly smart. I would add they're incredibly caring and well intended, but you can't fault people for what they haven't been taught. So hopefully, things like this IOM report help highlight those issues. And one other thing I wanted to delve into a little bit. When I got the report, and to people listening, I'll post a link if you go to the blog post page for this episode. The IOM report, it's 400 some pages. You can get a free PDF download. You can order a printed copy, but I downloaded the PDF, and one of the first things I did was do a electronic search for the word lean, and the word lean actually pops up quite often in the report. I was happy to see, your name. The reviewers included, great lean healthcare leaders like Dr. Gary Kaplan from Virginia Mason, Steve Spear from MIT, yourself, Dr. Brent James from Intermountain Healthcare. So it's great to see that perspective being embraced. What were some of the can you summarize some of the specific lean thoughts or ideas, or there were case studies that were presented in the report?
Well, I think they used one of them was Kim Barnes's work at DataCare on the lean management system, an article that she published in the Joint Commission Journal of Quality and Patient Safety last year. And, I think that, highlighting that sort of thing, which is, hey, folks, this isn't just a series of tools. There's a system involved here. And that system is the underpinning of understanding how to transform your entire organization, not just do a project-by-project improvement activity. And so I think that's, they clearly, and Mark Smith has been here, and I've, have had lots of good interactions with him. Clearly they understand that this is a system and a cultural transformation, and to use the example of the lean management system, as one of their highlighted areas means to me that they understand that. And I think that's an important thing because, I spend a lot of time talking to CEOs and senior executives and physicians, and like you said earlier, I mean, if they've done, 2 Kaizens in a year and a value stream map, they're doing lean, and we know that's crazy. I mean, this is a commitment to changing behavior, changing the culture of an organization, and focusing on getting 100% of your workforce learning how to identify and solve problems real time in the work. That doesn't just happen by some magic. You have to create a system, a management by process system that begins to get people to think differently every day that they come into work. And so I think the management system example was, to me, when they put that in there, that meant that they really got it.
Yeah, well, and that's great. Where if healthcare leaders or medical leaders are reading the IOM report and they haven't heard a lot about lean, then that's you're right. That's a great message. Kim Barnes's article is outstanding, and we'll see if that's available to folks as well. Maybe the last thing to touch on. You talked earlier, about something that's, I think, a goal, at least a stated goal of a lot of organizations. This idea of a culture of continuous improvement. It's tougher to make that a reality sometimes, it seems. But can you talk a little bit about the connections between continuous improvement and what the IOM report refers to as continuous learning, and how you see those going hand in hand and what that means in practice?
Well, quite frankly, I think it's a little wishy-washy in this report, and what I wanted to see was that more of sort of the Deming approach of okay, let's understand, stabilize, standardize, improve. So a little bit more of can we understand, first of all, what we mean by continuous improvement? What's the definition? And I think that's a little unclear here. And so continuous learning is great, but what does that really mean? I think that continuous improvement is it's pretty clear. But you have to understand how to improve something, and you have to understand the use of plan, do, study, act cycles and standard work, and those sorts of concepts. I'm not sure it's perfectly clear in fact, I know it's not perfectly clear in the report about how to actually do that. So I think that what they're getting at is building a continuous improvement culture using these principles that Deming eloquently outlined, but it's not perfectly clear.
Sure. Well, and one other thing I highlighted here in the report, it says the system, I guess, meaning like nationally or internationally even, the system needs to learn more rapidly, digest what does and doesn't work, spread that knowledge in ways that can be adapted and adopted. As we wrap up here, that sounds exactly the mission of the Healthcare Value Network and the things that the Theta Care Center for Healthcare Value is doing. If you can kind of recap, if people haven't heard about those initiatives, some of the things you're doing to help spread what works, lessons learned, and make sure people aren't copying, because I think it's important, as it says here, adopt and adapt. If you can just kind of share a summary of some of the latest results you're seeing in those collaboration efforts.
Yeah, so I think, our hypothesis is that adults learn by being exposed to other of their peers and actually going and seeing what their peers are doing. We've certainly learned that if you've seen one lean transformation, you've seen one lean transformation. So each organization takes a different approach. Obviously, the Shingo model is the one that we espouse in terms of what are the core components of a lean transformation. But the Healthcare Value Network is a group of organizations that have decided to come together to learn from each other, and so we take them to each other's sites for 2-day learning sessions, which are not in conference rooms. They're actually at the Gemba, so they're out in the emergency room, and they're in the ICU, and they're in the clinic. And so each organization gets to see how one of their sets of colleagues are actually applying these lean principles to transforming their organization. And we're doing a lot of these visits each year now, and we get tremendously positive feedback from the people that go to see these organizations. If you go to my website, which is www.createvalue.org, you can click on and look at who's part of the network now. We have some 57, I think, organizations and growing that have really committed to making these changes. And so they're learning from each other, and I think that's one of the best ways to do this, to spread it, is to just go see. And then we're at the center. We're doing a lot of training programs, learning programs. We're actually teaching the business performance system or the lean management system here at Theta Care now to other organizations. We have a series of other workshops, including Lean 101 that you're going to help us with, Mark, and we're also doing a Lean IT program, so that how would you design your your expensive technology to support continuous improvement. And we're going to be unveiling a whole series of other initiatives within the next year that have to do with leadership training and physician standard work training and other things. So we're trying to listen to our customer of, our customers, basically those organizations that are trying to do this, and they're telling us we need, these 5 things, and then we're going out and trying to build that with, either network members as our teachers or ThedaCare executives as our teachers or, experts like you and others.
Yeah, well, thank you for sharing what's going on, some of the latest things. I would definitely encourage people to go to createvalue.org. I'm happy to be working with you and the ThedaCare Center on that workshop that's coming up in December. So I'll post a link to that and links to some of the other things, the Business Intelligence Summit and some of the other new things that are happening. So John Toussaint from the ThedaCare Center for Healthcare Value, thanks for sharing your insights and taking time with us today.
Thanks a lot, Mark.
Thanks for listening. This has been the Lean Blog Podcast. For Lean news and commentary updated daily, visit www.leanblog.org. If you have any questions or comments about this podcast, email Mark at leanpodcast@gmail.com.